I call the member for Holt.
Thank you, Deputy Speaker. Tonight I rise to provide an update on the rollout of the headspace at Fountain Gate, and again congratulate the young representatives from the City of Casey Youth about their ongoing campaign to overcome the stigma that still exists in relation to youth mental health issues. Last month I spoke of my concerns about the Abbott government's decision to replace the Medicare local network with a new primary care healthcare network, primarily because the decision had caused a delay in the rollout of headspace at Fountain Gate. I'm pleased to report to this place that the South Eastern Medicare Local has been advised by Headspace and the Health Minister that it can now continue the rollout of this much-needed health space in Fountain Gate. Now, the auspicing body is the South Eastern Medicare Local. Its aim is to establish and co-locate a headspace with what is called, Deputy Speaker, an Early Psychosis Prevention and Intervention Centre. Its acronym is EPIC, at the Westfield Fountain Gate Shopping Centre precinct in Narre Warren. We know that the EPIC Centre will provide three core functions of acute care, early detection and recovery for young people suffering from a mental illness. The ages between 15 and 24 years are a crucial time in the development of a young person. This coincides with the peak onset of serious mental illness, including a first episode of psychosis. According to the Australian Institute of Health and Welfare, mental illness accounts for 50% of the total disease burden amongst young people aged 12 to 25 years in Australia, while 75% of mental disorders will have been developed by the age of 25. Therefore, concerted efforts focusing on early identification and effective intervention have now become an increasing public health priority, not only for Australia, but throughout the world. There is clear evidence that delaying the provision of appropriate treatment, which prolongs the duration of untreated psychosis, can have a major negative impact on the future development of young people, in addition to prolonging distressing symptoms and increasing the risk of premature death. Early intervention services like EPIC, through early detection and provision of accessible, welcoming, non-judgmental, youth-oriented access to the early psychosis treatments, can change the course of mental illness in young people. Now, EPIC is a world-renowned model of specialised early intervention in psychosis care, first developed by Professor Patrick McGorry, former Australian of the Year, at Origin Youth Health in 1992. Over the last 20 years, the EPIC clinical service experience has become the prototype for numerous early psychosis intervention services, both nationally and internationally. Deputy Speaker, our local area has a significant youth population. Some estimates are about 60,000 young people in the City of Casey. They deserve and they need this headspace and the EPIC Centre, which we all hope will be established by the end of the year. And tonight I also wanted to announce a pretty exciting development, I think, for the young people that have been lobbying for an appropriate fora to continue the discussion about youth mental health, that we will be holding another youth mental health forum to promote the need for action to address youth mental health challenges. Importantly, Village Cinemas, who's been a great partner of ours in the Westfield Fountain Gate Shopping Centre, is actually going to and has offered to provide a VMAX cinema so that young people can come and talk to Professor McGorry and myself about their issues. And I'd like to thank them for providing this facility. My staffer was on the phone to them today and they were very supportive, and I think that says a lot about the community spiritedness of this cinema chain. I know that Casey's youth are very excited about this forthcoming forum. We've got a lot of feedback from them. What our young people want is they want their voices to be heard, Deputy Speaker. Young men like Jake Downward, who's been in contact with my office for some period of time, would like the opportunity to further discuss the issues that he's dealing with. He feels, for example, that at the school that he attends that not enough care is paid or attention is paid when young people are developing serious mental health issues. He believes that when we're offering services to young people that we should be doing this in a user-friendly, youth-friendly way. And he believes to date that that's not what we've been doing. He's a young man, I think, with a brilliant future before him, and we believe also that his voice does deserve to be heard, and we're going to make sure that happens in the Youth Mental Health Forum. Danny Rothwell, who's been a leader for the campaign for the headspace of Fountain Gate, a young woman of enormous capability, is also campaigning hard for this Youth Mental Health roundtable and forum. I'd like to, in the time remaining, congratulate the young people. They've campaigned, they've got their headspaces and their epic centre, and I continue to commend them for the great work they do.
Order.